Abdominal clinical examination. Clinical palpation of the liver. Teaching of general surgery for medical students. Palpation of the liver. On palpation of the liver, we should start by deep palpation from the right iliac fossa upwards, step by step, and the edge of the index finger should be parallel to the costal margin. Going up, and when we reach up, we ask the patient to uh, take deep breathing and expire. On deep breathing, the liver descends by the diaphragm and hits or touches the palpating finger. We should be strict to the midclavicular plane. The midclavicular plane with the nipple plane with the mid-inguinal point, the three are at one plane. Should not go more medial or more lateral. Important notice, going medially we may approach towards the palpable, normally palpable left lobe of the liver and consider that is hepatomegaly. In fact, it is not hepatomegaly. The judgment of whether the liver enlarged or not is on the midclavicular plane, not medial to that plane, not lateral to that plane. Palpation of the upper border of the liver. We have found the liver not filled below the costal margin in that patient. To differentiate or to know whether the liver is enlarged, normal sized, or shrunken or in size, we should know the upper border of the liver. We can't do that except by percussion. Opposite the sternal angle, the space opposite the sternal angle is the second space, second intercostal space in the mid-clavicular plane, not medial, not lateral. In the mid-clavicular plane, the second space, the third, the fourth, diminished note here. This means that the upper border of the liver is in the fifth intercostal space, and this is normal finding. There is no enlargement of the liver. On palpation, when I go more medial, I can feel the left lobe of the liver here and have a bad interpretation, a wrong interpretation of hepatic enlargement. And this is not right. We should be strict to the mid-clavicular plane. Important notes on liver palpation. The liver is felt by deep palpation, starting from the right iliac fossa, strict to the midclavicular plane, felt by the index finger parallel to the costal margin on deep inspiration of the patient. Hepatomegaly is measured in centimeters below the right costal margin in the midclavicular plane. The surface is soft, smooth, and tender in patients having right side heart failure. The surface is smooth, firm in patients having obstructive zones. The surface is hard, irregular, and painless in patients having advanced secondary carcinoma of the liver. Hepatomegaly. This is the picture, huge hepatomegaly. I have the pleasure to invite you to subscribe to my channel and visit it to view and select what you need. This is the link of my channel. Good luck and best wishes.